Welcome to the session on basic concepts of nursing research. In this session, you will learn about what is evidence, why we need to do a research, what are the paradigms, what are the importance of nursing research, and meaning of some of the important terms. As we know, we are living in a world of quality, cost effectiveness, transparency, decision making. From where all these things comes? These comes from the evidence, which is produced from the research. And nowadays, evidence which is being produced through research cannot be taken from years back research like it used to be. Like years back we used to say 10 years back this study has suggested this. But now evidence may have the life of 2 years, 5 years maximum. So continuous research is very important. It is a systematic inquiry that uses various methods to solve the issues, problems, and to answer the questions. It helps to enhance the knowledge and the skills of the nurses to provide quality care. It also helps for clinical efficiency and the cost efficiency. If you remember kangaroo mother care, there was a time selected preterm babies used to get kangaroo mother care. But now the preterm babies and the babies who are born early before 37 weeks, all the babies are to be given kangaroo mother care. And now even in the normal delivery, it is being, as per the guidelines, it is being said immediately a child has to be put on the chest of the mother and the cord is cut there. So these evidence, from where it comes? These comes from the research studies. So now let us see what are the sources of evidence. Years back, tradition was considered as one of the important source of evidence because nurses used to say traditionally we are doing some procedure or traditionally we give care like this. Traditionally handover is done from bed to bed. But what is the evidence? That was not there. So you can see tradition is one of the way, but it is not scientifically proved. Authority, person with specialized knowledge. Is person is having specialized knowledge and the skill. They used to say when this person is saying this, this is evidence can be taken into consideration. But again, it may have the biasness. Clinical experience, working for years in the operation theatre, in ICU or any other ward. A nurse may have the clinical experience and may say, this is my experience says if you do something like this, this will have a good output or the care will be efficient or cost effective. This can be taken into consideration, but again scientifically it is not being proved. Then trial and error. Suppose there is some situation and by trial and error someone is able to solve the problem. But again it can be a situational, it can be a through by chance, but again it will have a you can say biasness. Gathered information is another source of evidence. That means information in the hospital is collected for various purposes. Maybe for report writing, decision making, or to see the effect of the care, or for any meeting purpose. But that may give some evidence. But again, how authentic is that information? How you can interpret just from the data some information can be there. If some only data is there, you have to then again interpret it and you have to see there is no biasness, and in interpretation you have to scientifically interpret. So this is again one way of saying that this can be one of the source which can be integrated. But the final one is always doing a specific research to answer various questions, to solve the problems, to take up the decisions. Because when you take some decision, you have to justify to the higher authorities why you are taking this decision. Suppose a nurse administrator demands more staff. What is the justification? Just saying, I do not have enough staff to give care is not enough. She has to do maybe a work study, time motion study, and see what is the workload of the nurses. If in future hospital is planning to expand, how many nurses she needs? What type of care is provided to the patients there? So with this, she has to do a small research, give an evidence, follow the steps, and even in justification, she has to write what is the current situation and what are the challenges and how number of nurses if increased can bring in cost effectiveness and even the clinical care effectiveness. So you can see what is the importance of doing a research and in clinical area taking decision not only for the patient care but also administratively if any decision is to be taken which has to be backed by a evidence. So these were some of the sources of evidence. Now paradigms and the type of research. There are two main paradigms, positivist and constructivist. And the methods of research are quantitative, qualitative and mixed method. So let us see what is positivist paradigm. Positivist was rooted in the 19th century, especially by the Newton and Locke. They said fundamental assumption is that there is a reality and that can be studied and known. Assumption is that it is believed to be true without verification. That means reality can be studied by a researcher following certain procedure. So even the positivist says, example, you can see on the screen, if a person has a stroke, researcher believe in positivist paradigm assumes that there must be one or more factors that can be potentially identified. Within positivist paradigm, it is aimed to understand the underlying cause of the issue or the problem. Here, what the researcher will do? Identify the problem, review what is the current situation, review the reports, then try to find out with the history, with the examination, investigations and collecting data through questionnaire, tools, maybe interview, then find out the underlying cause. Then they will relate with the existing study and find out the evidence and say, yes, these are the causes. Positivist approach involves a systematic procedure with controls over the research questions to test the hunches, that is to test the hypothesis about the phenomena that have a relationship among them. There are various variables in the study and the relationship of the variable are being studied. Again, here the researcher will review, have a dependent and independent variable, confounding variable. This we will understand over the time about the terms, what they mean. Then they will collect the data, analyze. Then they will say what are the factors affecting, what is the relationship between these factors. But there is a controlled process. That means researcher will control the full process of the research by selecting the sample, allocating to the case and the control group. When they administer the tool, they will follow the guidelines, the biasness of the researcher will be taken care of when conducting a research. Now the constructivist paradigm. Constructivist paradigm was especially the philosopher Weber and the Kant, that they said fundamental assumption is that study is not a fixed reality. That means reality is not fixed. There will be a change in the reality depending upon the interpretation of the individual, interpretation of the family, interpretation of the communities. If there are multiple interpretation of the realities, people mind, then there is no process to find out the truth. What we have seen in the positivist paradigm, you can find out the truth because that is scientifically, and the controlled experiments are being done, quasi experiments are being done. But in the constructivist paradigm, here we see what people interpret the reality situation, that is subjective. Interpretations are subjective to the people, what they believe, what are their experiences, and findings of the constructivist inquiry are product of interaction between the researcher and the participants. But in the positivist, the interaction of the researcher may be independent of the participants. Now let us see what is the difference in a concise way. In the positivist, reality exists, there is a real world. Researcher is independent of participant. Bias needs to be checked by objectivity. But in the constructivist paradigm, reality is subjective, constructed by the individuals. Researcher interact with the participant. Subjectivity and values are inevitable. Deductive process, the positivist. But constructive say it is inductive process. There is a hypothesis testing in positivist. Focus on objective and quantification. You can see, by seeing the difference, you can assess what are the methods used in the doing a research. Fixed pre-specified design is there. Measured quantitative information, statistical analysis and generalizations can be done in the positivist approach. But in the constructivist, hypothesis is generated. Focus is on subjectivity and non-quantification. Flexibility is there and designs emerge while collecting the data. There is a narrative information. Qualitative analysis and in-depth understanding is there. So there are two methods of research, quantitative and qualitative research. Quantitative research is a systematic way to define a problem, objectives, hypothesis, research approach, sampling, data collection, analysis and interpretation. Minimize the bias and maximize the validity. Quantitative data is analyzed statistically. Collect empirical evidence that can be generated. So what is the advantage? There is a fixed way, there is a flow, pathway is there. Randomization is done. Control of the intervention variable is done. Confounding variables can be taken up. The researcher and participants have no subjectivity will be there. Tools are being made in a way that you collect data, analyze statistically. The data can be, and level of significance can be fixed and you can analyze. Say you are accepting the hypothesis or null hypothesis is rejected or accepted. So you can see how from the positivist paradigm your quantitative method is being emerged. Now we see the qualitative one. Qualitative method. I think by the word you can understand. Understanding the human experiences as they live. Researcher collect and analyze qualitative, narrative, subjective information. Remember these words: qualitative, narrative and subjective information. Researcher emphasize on dynamic, holistic and individual aspect of individual life and capture them. Flexibility in data collection is there as procedures emerge during the study. You cannot fix up a data collection procedure in qualitative study. As you go on collecting your data, you can emerge with the process. What next? What next? What questions I have to ask? What will be my in-depth interview? It will be focus group discussion. It has to be a specific group. Or how much in-depth I have to go understanding the life experiences, perceptions, stories of the people. If you see, collection and analysis of the information is done simultaneously. Researcher gain insight and new questions emerge. What I have said, findings are grounded in real life experiences. Researcher integrate information to develop a theory. In quantitative, what they do? They test the theory. In the qualitative, they develop a theory. Rich, in-depth information is collected to clarify various dimensions of the phenomena. So, what is the purpose of nursing research? Already we have said, to answer the questions which are unsolved. There can be new questions because every patient is different. The care is different. You cannot say, I have made 2 months back one care plan for a patient. Same I can apply to another patient when they come with the same diagnosis. No. Maybe the problems may be similar, but care can be different. Then you have to solve certain problems. When you work in the hospital, various type of problems emerge. Maybe the old solutions you are not able to follow the old solutions. So find out a new solution. Especially nowadays, the problem of limited resources, limited human resource are also there. Always everyone says, I have very less staff, how to work? But you have to work within those limits. It is a man, money, material, whatever is there. Your department say provide cost-effective, efficient care. So you have to find out solutions. How I can provide best care to my patient within these limited resources. Suppose there is some issue, the problem is there with the staff. They are not coming in time or punctuality is a problem, whatever. You have to solve the problem. You cannot only punish them, then no one will work. They will get demotivated. Find out a solution, how you can motivate them. You have to understand their individual needs. So find out the solution to the problems. Provide explanations and justifications. If you have to demand something from the government, from your institution, from your governing bodies, you have to give an explanation which has to be supported by justification. That you can bring in through research. You can bring in through research already done, and when you do a research, you justify in a local context, this is my need. How it can improve the patient care, how it will be cost effective, and even how it will benefit my institution and community. So you can use various methods. It is exploratory, descriptive, correlational, it can be case studies. So it all depends what type of study you are doing. So one of the purpose of research is identification. Researcher conducting qualitative studies, a phenomena about which very little is known. Therefore, in-depth probing will help to answer the various questions. like experience of the women in breast cancer treatment. Because every woman will have different reaction when they are being diagnosed with the cancer. In the real life also, when you see, it depends upon the stage of the cancer. It depends on the family support. It depends upon the individual own mental health and emotional maturity, how they take up. If you say someone, you have a cancer, people have a reaction, no, I am not going to survive. I will die. That is the first reaction. So, you have to study this, then identification, explanation, predict what are the factors that may cause the reaction. What are the life experiences of that person? If the person has seen in their own family death after the cancer, maybe within few months, immediately reaction, I am not going to survive for years. So, taking in-depth experiences when diagnosis was announced to the women about the cancer, what was the reaction? Next is description. Describing something, studies researcher count and classify like number of cases, when, where, how many. Quantitative description focus on prevalence, size and measurement of aspects. Like COVID cases. How many cases in Delhi? How many cases in India? How many cases in the world? Where? Which are the pockets? Initially where it started. So that is description. Then qualitative research focus on nature and dimensions of phenomena. Exploratory quantitative research begins with the phenomena to examine the nature and manner in which manifestation the causing factors. You explain what are the causing factors, what is the relationship, what is the association with demographic factors. Then qualitative research can be used to study the nature of phenomena in depth. So you can see on the same aspect you can do qualitative and quantitative study. If you want to go in depth to find out the underlying causes, perceptions, experiences, you have to do the qualitative study. Explaining some new phenomena, like when the COVID came, no one was knowing what is COVID, what is the causative organism, what is the natural history of disease. So, thousands of research was done during that time to understand first what is COVID, what are the causes, where it emerged as a first case was there, then which you can say location, setting, age group which was affected, how it was spreading so fast, then what can be the preventive measures, what is the treatment. Over the time, they could understand virus which was causing it, what can be preventive measures, what are the treatment, vaccine was developed. So, explaining the natural history of disease, explaining the treatment, the research is done in various areas. If even previously some research is done to see what further can be done to strengthen the knowledge and skill in that area. Prediction and control. You are predicting something. Some phenomena can be predict or the control, like incidence of Down syndrome. If the age of the mother, women is more than 40 years of age, Down syndrome is very common. So, you can predict, but you can control the situation. But again, every case is different. Importance of research. Every profession has to build up the knowledge, body of knowledge, because you cannot survive on the old knowledge. Advancement of technology, advancement of knowledge force the professionals to strengthen up the body of knowledge. Utilize these knowledge for the decision making. Validate what is already there and what can be in the future. Now, evidence-based research. That means what therapy or intervention can result in better outcomes? What test will assess the patient critical condition? What factors can cause the disease? And many other questions needs to be answered with the evidence. Evidence-based care will help to improve the study of nursing care, provide best of the care to the people, and to take the decisions which comes from the rigorous research. You can say this is the hierarchy of evidence. If you see, the weakest is expert opinion and case reports, then case studies, cross-sectional studies, case control studies, cohort studies, randomized trials, and strongest is meta-analysis and systematic reviews. But it is not only the one factor. You have to take into consideration all the evidence to give the evidence or the justification. Steps of evidence-based care is scientific method. Find out a problem, review, collect data with the tools, analyze, interpret, summarize, then find out a solution. Then integrating evidence into the practice, present your findings to the authorities and utilize the findings. That is the actually ultimate aim, how you utilize the findings of the research. Meaning of the terms, some important words. Variable is a characteristics which you study. It can be a nurse, it can be anything, smoking, interventional package, whatever you say, variables are there. Independent and dependent variable. Dependent variable are which go through changes in the quality or quantity, and independent variable is which bring in change. That you can see in this example. Respiratory complication is dependent variable and teaching intervention is a independent variable. There are certain confounding variables which are in between, which comes maybe from the experience of the patient or maybe from the some other literature which will affect your research findings. Operational definitions are the terms which you have defined what you mean in your research, not the definitions which are given in the dictionaries. Hypotheses are the hunches which you have to prove, which can be null hypothesis, which shows there is no difference between the independent and dependent variable. Again, this you have to prove statistically. And the last is assumption, that these researcher believe, assumes that whatever relationship they are studying are true. So in this way, today in this session, we have discussed about some of the basic concepts regarding the research, the paradigms, research approaches, research approach, evidence-based practice, what are the basic terms which are being used, what is the importance and purpose of the nursing research. This will help you to understand why you want to do the research, why it is important to justify your findings, how you can provide cost-effective care, and research will help you to justify your demands and analyze what type of care you are giving and what and where you need the improvement. Thank you. Welcome to the session on quantitative and qualitative research methods. It is important to understand what are the various designs you can follow when you are doing quantitative and qualitative studies. So in this session, you will learn about difference between quantitative and qualitative research, mixed method research, experimental and quasi-experimental designs, and qualitative studies. As you can see from the qualitative and quantitative methods term, you can understand what type of data quantitative studies or the method will generate. That means the quantitative will have numbers, units, prices, in the word of data, numbers. But in the qualitative, which are being expressed in the words, in the stories, perceptions, and the situations. So you can have the narratives by the people. Let us try to understand what is the difference between qualitative and quantitative research. First of all, the data, numbers, but in qualitative that will be words. Control and the comparison group. In quantitative there will be a control and comparison group, but in qualitative there will be no. Method, quantitative, experimental and quasi-experimental, but in qualitative it will be narrative and inquiry. Then sampling, it will be random sample and the large sample will be there, but in qualitative it will be purposive, convenient, or it will be small. Tools for data collection. In quantitative you will have a structured closed-ended questionnaires, you will have observation checklist, and sometimes some semi-structured questions can be there. In qualitative you will have in-depth interview guide, open questionnaire, focus group discussion guide. Then questions, type of question, how much, how many, because you have to collect the data. But in qualitative you will say what, why, you have to ask the questions. Statistical methods, what you can use is percentage in quantitative, mean, regression, ANOVA, depends upon the study what you are doing. But in qualitative, it will be your narrative data analysis. There will be themes which you identify, then you will analyze them. Storage of the data, in the quantitative, it will be stored in the form of numbers, but in qualitative, it will be your stories, it will be words, expressions and experience of the people. Again, the quantitative large data will be there. Provide broad overview and can be generalized because statistically you are going to prove it. There will be less bias. Data evidence can be used for decision making and can be generalized. But in qualitative, there will be specific data because they are subjective, interpretive data experiences of the people. Overview is specific to the context, but you cannot use it for the evidence to take decisions, but you can go in depth. So, qualitative and quantitative difference again in a different way. Quantitative is objective, qualitative is subjective. Quantitative is deductive reasoning and qualitative is inductive reasoning. Quantitative focus on concise and narrow, test theory, see cause and effect relationship, analyze the numbers statistically and generalize the findings. On the other hand, the qualitative focus on complex and broad issues. They develop theory. They give meaning to life experiences, meaning to the perception of the people. analyze the experiences, narrative analysis is done, and interpretation changes as the individual perception, thinking and experiences changes. You can say in the quantitative, if you see you want to study what is the impact of hand washing training on knowledge and the skill of the nurses, there will be a questionnaire, observation checklist, you will collect the data, have the scores, you will analyze statistically. On the other hand, this is just an example to show you the difference. What are the experiences primary gravida mother or the women in the labor room? You want to know, understand the experiences of the mother when they are in the labor room for the delivery. So there can be unstructured, semi-structured interview guide, or there can be you have to then go in depth to understand their perception and their experience. And mixed method research, it is a combination of qualitative and quantitative approach. It's not simple, but there are certain methods to combine quantitative and qualitative research. What you will do? You will do triangulation, sequencing and cross-analysis. This is very important to understand, because when you use exclusively one method, you will leave out some of the information. When you do exclusively quantitative studies, statistically you are you are able to show level of significance, and you will so statistically they are significant. But what about the realities? What is happening in the ground level? That you will bring in from the qualitative data. But on the other hand, if you do exclusively qualitative study, you cannot generalize the findings. You cannot take decisions based on that. But further, from the findings, you can conduct a quantitative study. So let us see that. What can be done? Triangulation. It is used to look at data from different point of view. For example, collecting data via different methods, talking to different groups of the people. That means you will collect data from the field, you will collect data from the records, you will go and speak to the authorities, to the administrators, to the stakeholders, to the patients. Then you will correlate all these things and do the triangulation, which will help you to justify the findings and to say, yes, what was my question? This I am able to find the answer. In triangulation, even what you can do is, triangulation is designed for the improving the quality of information. You can improve the quality of information because you are analyzing from different sources. It becomes more reliable. Compare the information generalized through quantitative and qualitative method. Statistical data may show that there is a dropout in the school, in the teenager girl. But qualitative information may focus on the, after focus group discussion, girls really, you may say they reveals that the school environment needs to be improved. But you are not able to show this school environment improvement through quantitative data. From where it will come? It will come from the qualitative data. Because that's why some of the research are not able to answer all the questions or able to find out solution to the problems. Now there is sequencing. Sequencing means first you will do a quantitative study, then you will do a qualitative study, or you will first do a qualitative study, then you will do a quantitative study. Using the result of qualitative study to develop theories or hypotheses, then they can be examined through quantitative methods. Or quantitative findings from a large population are collected and then examined particularly for some special context in one area in-depth interview and focus group discussions are being done. So you can see sequencing means doing one type of study, then coming to the next type of study, using the finding of a survey to help to identify a sample of cases to follow up in greater depth using qualitative methods. So you can say first is triangulation, then there is a sequencing. Third is cross-analysis. It is combining two methods for cross-analysis. Quantitative data is often analyzed qualitatively in order to validate or draw out the meanings. Analyzing tables, chart and graphs, you can say experiences, quantitative data, discussing the implications. That means you will combine your qualitative and quantitative data to find out the meanings, what is the in-depth information you are able to collect, then you will give the implications and for future recommendations. Translate qualitative data into quantitative formats or quantitative into qualitative. This approach particularly useful when you are doing monitoring and evaluation, the complex area of work such as governance, empowerment, capacity development of the building, which will help you to come out to the solutions. So, quantitative research is experimental and non-experimental design. I think most of you has gone through these studies, but let us see some of the designs to review our knowledge. The first design, if you see, is very common one which is being used is symbols. Let us understand. Symbol X indicate exposure of a group to experimental variable and effect of which will be measured. That means this is something you are going to do. Symbol O, that means process of observation or measurement. Symbol R indicate random assignment to identify the treatment group. This is very specific XOR for the experimental design. The most important design, pre-test, post-test control group design. You can see here how it is being indicated. There is a R, O and X. All the three randomization is being done for sampling of the control and the case group. Statistical test of significance is done, but that does not prove comparability and comparison groups or the difference found in the groups. So you have to do the t-test. This is just an example I am showing. It depends upon the study what statistically you will do. So next design you will see Solomon 4-group design. This is very important design. There is no statistical method in which you can use specifically. It depends upon the study and the data and the objectives of your study. But the findings, the generalizations can be done through this group. This is a very strong group in the experimental design. The third is post-test only control group design. You can see here how it is being designed is highlighted. Here the t-test is optional and covariance analysis can be done. Again, these are just examples. Everything depends upon your study objectives, hypothesis and what you want to study. Quasi-experimental designs. Mostly nursing studies students are doing quasi-experimental designs. Time series experiment, periodic measurements on the group is being done and the changes are being noted. Results are indicated by discontinuing in the measurements are also recorded. Here you see R is missing. There is an observation, there is a treatment, but randomization is not done. So that is a major difference between experimental and your quasi-experimental group. Next design, if you see, that is your equivalent time sample design. It provides baseline against which the comparison can be done on the effect of experimental variable. In group 1, experimental variable is present, but in group 2, it is absent. Here, test of significance is done. Non-equivalent control group design. You can see experimental and control group both are given pre and the post test, but control and experimental group do not have the pre-experimental sampling equivalence. So it depends what type of study you are doing, what design you will follow, but you have to be very careful when you select your design of your study. Qualitative research. Researchers are interested to understand the meaning of the people, what they construct. What as a researcher you are constructing, it has a different meaning. But what people think, that is how people make sense to their world and experiences, that is very important to understand. Then only you will be able to find solution to the problems. Your qualitative research use methods such as participant information or case studies, which will have narratives, descriptions, case studies. Your qualitative research is an inductive, flexible in nature. These are qualitative, they collect qualitative data and analyze. Participant observation is for collecting data on naturally occurring behaviors. Sometimes you must have heard where many researchers go and live with their families, go and live in that area for 6 months, 1 year, 2 years to understand people. What is their culture, how they live, what they eat, what they think, what are their traditions, what are their values. So participatory observation is there in this. They do in-depth interviews, not only with the families, but also with the community people. They go in-depth personal history, perspectives, experiences, particularly on the sensitive issues. Even with the patients who have AIDS, who have cancers, who have tuberculosis, what are their experiences, what they feel, to find out solution to their problem. Because confirmation, you can say the treatment when they leave, why they are leaving the treatment, what are the reasons. Statistically you can say, but underlying factors, economic factors, social factors, psychological factors, what are those? What is their family support, what are their family relationships, how they will find out through qualitative studies. If you see, focus group discussion is done when there is some issue which is common. The researcher goes to the community with the small group. They have a focus group guide. Then they do focus group discussion to find out in depth what are their concerns, what are the cultures, and what they feel, and what are the solutions, even what they feel, they can be find out. Approaches to qualitative research, phenomenology, ethnography, grounded theory methods, case studies and narrative analysis. There are many others, but these are the most important one. Phenomenology. It is an approach to explore and understand people's everyday life experiences. Life experiences give meaning to each person's perception of a particular phenomena. For example, explore experiences and reflection of people affected by COVID. What are the experiences of people who were affected by the COVID? What were the experiences of families who have gone to the hospital but not able to get treatment? What were the experience of the people when they have to live in isolation? So everyone had a different experience. On the other hand, what were the experiences even of the health personnel who have given care to the patients? So phenomenology brings in the life experiences of the people. Ethnography, as the word says, here it is a qualitative inquiry about some description, you can say, or interpretation of culture, cultural behavior, what I was telling you, People go and live with the community, try to understand them. It involves extensive field work. They infer the culture, actions, perception of the people, and they write what people say, not what I am able to understand, but what people say. They explore the meaning to the context from the people. Then grounded theory method begins the focus with the research problem. Then they find out a process to solve that, how this problem emerged, collect data, and during this study, they process emerge and they go on collecting the data analysis, data collection, and even the sampling occurs simultaneously. Like you want to understand the process of trying to quit smoking. When they started, why they want to quit, what are the challenges, what are the problems they have faced. So simultaneously questions also emerge, data will be collected and sampling will be done even of the family, friends and many other. Now the case study. I think this is very common. All of you are doing a case study of a patient when you are working in a hospital or when you were a student. You have in-depth investigated a single patient or a family or a community. An in-depth interview has been taken and then you go in depth about the disease of a patient, family history, personal history, and then you collect data, analyze and find out what support or the treatment can be given, like in-depth case study of the parents making decision for life support for a child in ICU. Then it is a narrative analysis. Very important one. Now many people are doing this. It focuses on stories as object of inquiry. It tries to understand how individual makes sense to their life. Narrative analysis on the birth traumas. Narrative analysis of the people during disasters. How they have undergone that situation, how they have handled that situation. What are their experiences? I think this session has able to make you understand what is the difference between qualitative and the quantitative studies. What are the methodologies you can use? What are the various designs of the experimental, quasi-experimental studies? Again, what are the statistical methods you can use? Again, it depends upon the objectives and the questions. What are the qualitative studies? And how you can integrate the mixed method. Mixed methods, that is triangulation, sequencing, cross-analysis. So something, either all one of them, or you have to mix triangulation and the sequencing, something you have to do for the mixed method study. So I hope this will help you to understand how you can design your study, how you can plan a study which will bring in qualitative and the quantitative data, which will support your decision making, and you will get the in-depth understanding of the situation. Thank you so much.